Good morning, everyone. I am Dr. Shoshavan from CMC Vellore. So I'm going to present this study titled as Primary Sclerosing Cholangitis, India Differs from the West, a tertiary single center study. So as we all know, primary sclerosing cholangitis is characterized by a progressive cholestasis and eventually decompensated chronic liver disease. So its association with IBD is also well known. But data regarding this the clinical profile of this disease from Indian subcontinent are scanty. So this study was to had an aim to assess clinical features and presentation of PSC. So the IBD database upon institute of 1,952 patients, along with that, the discharge summary and medical reports from the period of 2015 to 2020 were screened. And 100 patients with the diagnosis of primary sclerosing cholangitis based on suggestive clinical features and radiological imaging were included. And data was collected and analyzed for demographics, clinical presentation, laboratory data, histology, coexistent IBD, and ERCP in these patients. So this shows the baseline demographic features and the presentation. So for these 100 patients, the median age was 39.5 years and predominantly males, 67%. And the distribution was such that 69% of the patients were from East India, eastern part of India, and 31% from southern India. And the predominant presentations were jaundice and pruritus, 72% and 46% respectively. 11% presented with cholangitis, and 5% has ascites at presentation. The median symptom duration was 12 months. 7% were asymptomatic on presentation, and features of portal hypertension was present in 46% of the patient. The median male was 13. So all these 100 patients had received had MRI done, and large duct PSC was diagnosed in 98% of the patient, 42% being intrahepatic, and 41% being both intra and extrahepatic. 15% patients had a extrahepatic presentation. Liver biopsy was done in 34 patients out of 100, and small duct PSC was diagnosed in 2% of the patients, and biopsy-proven autoimmune hepatitis PSC overlap was diagnosed in 11% of the patients. The association with IBD was found to be 31%, and 42% of these patients had IBD antedated PSC by median of 2 years, and in 45%, both of these conditions, PSC and IBD, were diagnosed simultaneously. And in only 13% of the patients, PSC had antedated diagnosis of IBD by median of 2 years. 79 patients had undergone colonoscopy out of these 100 patients, and ulcerative colitis was diagnosed in 77.4% of the patients, and the predominant phenotype was that of pancolitis, that was 83%, and followed by extensive colitis, that is in 12.5% of the patients. Crohn's disease was diagnosed in 3 patients, that is 9.6%, and indeterminate colitis was diagnosed in 12.9%. Endoscopic biliary intervention was done in 13 patients in this 100. The predominant indications were dominant biliary stricture in 9, cholangitis in 3, and colodocolithiasis in 2. On ERCP, findings were hilar strictures were noted in 2 patients, common bile duct strictures in 4, and peripheral strictures in 8. Colodocolithiasis was noted in 3 patients. Biliary stent placement with or without dilatation was done in 11 patients. And complications post ERCP was noted in the form of bleeding in 1 patient, cholangitis in 1 patient, and 3 patients required repeated ERCP interventions, repeated ERCPs. The associated hepatobiliary disorders in these patients were as follows. 13% of the patients had cholelithiasis. 1 patient had gallbladder carcinoma. However, none of the patients had hepatoma, cholangiocarcinoma, or colorectal carcinoma. So the main limitations of this study was it has a retrospective design, and the follow-up data of these patients are still awaited. So to conclude, IBD is seen in 1/3 of the patients with PSC, and ERCP in PSC is associated with complications, and so it needs a careful a priori need assessment prior to the procedure. Thank you.